All right, so let's talk about insurance in healthcare. It's a scary and it's a shitty situation, and it's never good because it's the worst. Just the American healthcare system is just a fucking mind fuck. And this is coming from someone who actually works in the healthcare system. So if you're not a nurse, if you're not a healthcare provider, if you don't deal with insurance on a day to day, I don't expect you to know as much as me, and even as much as I know, it's so much that you can't understand it. You can't wrap your head around it, and this is the reason they do it, is because they can slip in these crazy bills and cost you a fortune for going to the goddamn hospital. So let me give you a little bit of a story, and this happens to many people. It's anecdotal, but there's a research. Just hear me out. Hear me out. So there's a man that went into an in-network emergency center, which means he had health insurance. He went to an emergency room, and that emergency room was part of his healthcare plan, right? They said that hospital works with his healthcare plan. He still ended up with a bill that was $7,924. Insanity. So January 28th, 34-year-old Scott Kohan woke up in his emergency room in downtown Austin, Texas, with his jaw broken in two places. The result of this violent attack the night before. Witnesses called 911, which dispatched an ambulance that brought him to a hospital, and he was unconscious. When he woke up, the first thing he did was grab his iPhone. Lying in there with a broken jaw, I go to the Humana website and see the hospital listed. So I figured, okay, I should be good. Except he wasn't. While the emergency room where Kohan was seen was in his hospital's, in his insurance's network, the oral surgeon who worked on him in the ER was not. That's how Kohan ended up with the basically $8,000 bill. So this was a report done by Vox, and they did a really good thing, and they have been doing a really good thing, and that's the reason they've been able to tell the story, is because for the past couple of months they've been collecting data on this specific issue, on patients going to emergency rooms and getting astronomical high prices. And fun fact, this has actually happened to me. I'll tell you that in a little bit. In the past 6 months, Vox has collected more than 1,300 emergency room bills submitted by readers in all 50 states and Washington, D.C. as part of an investigation into emergency room billing practices. The University of Missouri, Kansas City, published a study last year that found as many as 1 in 5 emergency room visits led to a surprise bill from an out-of-network provider involved in the care. So understand this, even if you're a patient, and you do everything right, you get into a car accident, you're in pain, you're hurting, you need to go to the emergency room. There's 3 hospitals. The hospital furthest away is the one in your network. So you decide to take the drive in pain, or get an Uber in pain, or have someone come pick you up in pain and go to your network hospital. You do all of this because you don't want to face the astronomical charges of going to an out-of-network hospital. You go there, but once you get to the emergency room, everything that the nurses do, everything that the doctors do that are in network are good. But if you need emergency surgery, if you need something, and an out-of-network doctor, a surgeon, or provider is at the hospital that is in network, you still get charged for everything that specific provider does on you for you, which is mind-numbing, and it is so frustrating. And understand why. The question is, why can't all the doctors who are in the hospital be just in the network? Yes, technically, the vast majority of the doctors that are at the hospital are in network. That's a fact. But if you need a specialist, if you are a cancer patient and they need a special surgeon, if you need a special doctor, if you need a special eye doctor, whatever, if you need a specialist and they come to that hospital for you, or they're just doing the care rounds for those cancer patients, eye patients, whatever patients, and that doctor is not part of the network, but the hospital needs them to take care of the patients, they still need to be there. So you can't blame the doctors. It's not the doctor's fault. Right? They have the choice. Yes, technically they have the choice, and I don't know the details about that. Hopefully one day we can ask and find out. But it's not their fault, and it is just it's a lose-lose situation, right? The insurers don't give a shit. They really don't care. They definitely not gonna pay for an out-of-network doctor. They give you the information beforehand, telling you that these are the doctors. Not these are the doctors. They tell you these are the providers that are in network. These are the providers that are out of network. And yes, technically, it is your job to figure that out. But once I step into a hospital that is in network, you better believe I expect everything in that hospital to be considered in network. It's a shitty situation. I don't know what the answer is outside of universal healthcare, outside of a single payer system for the whole country, outside of something simple where you're not doing calculations while your arm is half off of your body because you're trying to figure out who the goddamn hell is in network. This is so frustrating. It is just really, really frustrating the amount of back work you have to do on top of the crazy prices you are already paying for insurance to make sure you're not paying an extra $1,000, $7,000, $8,000 because a doctor at an emergency room that is in network is out of network. I'm sorry for getting loud. I'm sorry about this craziness. It's just, you hear stories like this every single day. Oh my goodness, I've been paying for this medical visit or emergency room for 5 years now. I've been paying a $10,000 bill because I went to the emergency room when I was vacationing in Florida. You hear these stories all day, every day. And like as a nurse, you hear patients tell you, yep, I'm not taking that medication. It's too expensive. Yep, my insurance is not covering this treatment. I'm not doing it. Yep, my insurance. And it's like, fuck. Do we really have to balance how much we make with the health of ourselves and our families? Is that like, why? Why do we want that?